Hey y'all, we're going to make sense of tension type headaches, which is arguably one of the most common primary headaches along with migraines. Now, if your pain feels like a tight band around both sides of your head, it's mild to moderate in intensity and it doesn't worsen with normal activity, then you might be suffering from a tension headache. Before we jump into this incredibly important topic, I'm Dr. Nazneen Jamal. I'm board certified in internal medicine and I'm here to make the medicine make sense. If you like this content, give me a thumbs up and subscribe. So let's just go ahead and start. One of the distinguishing features of a tension type headache is that the pain is bilateral, which means both sides. It does not throb, and patients will often describe the symptoms as a pressure or tightness. Can be orbital, but it's usually both. And sometimes they'll describe it as wearing a too tight of a hat. It is mild to moderate pain. It is not severe. If it is described as the worst headache of your life, then it is unlikely to be a tension headache and the doctor needs to look at other things. You will not experience gastrointestinal symptoms such as nausea or vomiting. Routine activity and chores will not exacerbate the symptoms. Tension type headaches are extremely common. In the United States, researchers conducted a study in 1993 to 1994 where they telephoned respondents and around 13,300 participants were involved. They reported that episodic headache was more common than chronic. Women were more likely to be affected. People between the age of 30 and 39 were the group that had the highest frequency of headaches compared to their older and younger counterparts. Episodic is less than 1 day per month. Then we have frequent episodic, which can be up to 15 days per month. And then we have chronic, which is 15 or more days per month over a 3-month time period. Now, many people with mild or infrequent tension type headaches will never seek care because their headache symptoms are not severe enough and they actually go away. And if you're having headaches less than 1 day per month, seeking care may be more burdensome than actually dealing with the symptoms when they happen. However, even in infrequent and episodic tension type headaches, the headaches and the burden that's associated with it can be excessive. Sometimes people will call off from work or from school. Now, how does this actually start? So we've got peripheral and central triggers. Initially, there is some pain associated with the scalp and the muscle. There's a tight sort of tension, and the alarm signal of the brain sends off triggers to the central part to sense pain and causes a headache. But over time, this alarm continues to start blaring even when there is no smoke or actual signal of tension. And that's when it is sensitized. So in short, the headache begins in the muscles, but it can become hardwired into the brain's pain system. Now, there are triggers that a lot of patients will identify. And some of those triggers include stress, lack of sufficient sleep, dehydration, drinking too much alcohol, bright sunlight, sustained head and neck posture problems, and sometimes a history of migraines can actually increase the risk of having these headaches. Women tend to be affected a little more than men, and we often advise patients to keep a headache diary in order to help facilitate the identification of triggers. By writing down the context of the symptoms, when they happen, and any associating features, it helps patients identify possible triggers. Menstrual cycles have also been known to cause tension type headaches in some. Now let's compare tension type headaches to migraines and clusters, which are the other primary type of headaches. Migraines are often unilateral. They throb and they are worsened by activity. Nausea may be common and there may be light sensitivity, photophobia, and sound sensitivity. Sometimes there's aura, which are these short reversible set of symptoms or neurologic symptoms that may consist of flashing lights, blind spots, maybe a little bit of static before or during the headache, but they reverse, they go away. And those are often caused by like a temporary firing or changes in brain activity and blood flow. Cluster headaches have severe pain and they're also unilateral with autonomic signs such as tearing, a red eye, nasal congestion, runny nose, and they can often appear in clusters or attacks. For episodic tension type headache, you need to have at least 10 episodes lasting 30 minutes to 7 days. The patient's identified with chronic tension type headache, which usually involves having headaches of at least 15 days or more per month for at least 3 months. there may be symptom-triggered treatment. And if the patient meets criteria for migraine 2, then it's more likely to be a migraine than a tension-type headache. Medication can cause a rebound headache effect when overused. Now, here is when people with tension-type headaches need to seek urgent or emergent care. If the headaches all of a sudden become severe, and then there's a new pattern. If it all of a sudden goes from bilateral to unilateral, which is one side. If there's neurologic symptoms such as weakness, slurred speech, facial droop, numbness or weakness in one side of the body. If it starts occurring after the age of 50, if it's in the presence of cancer, pregnancy, or recent trauma, if you're on a blood thinner and you have these symptoms, if you're immune suppressed, usually in these cases, we're going to get an MRI because it's the best test to look at the brain structure. A CT may often be used first if there's a suspicion of an intracranial hemorrhage. When it comes to recording the symptoms of your headaches, a headache diary is often used. And in a headache diary, you want to talk about the timing, the symptoms, the triggers, what happened before, what happened after, and how often they happen. Bringing these journals to your doctor can actually help you identify those triggers. So, in short, tension-type headaches are throbbing, they're mild or moderate, they are both sides, and they do not worsen with normal activity. There are no symptoms of nausea and vomiting. You may have photophobia, which is sensitivity to light, or you may have sensitivity to sound, but you don't have both. If this helped, give me a thumbs up. I'm Dr. Jamal. I'm board certified in internal medicine, and I'm here to make the medicine make sense to you. Until next time.